Hello mga ka-listeners. Today we have to discuss about your tetracyclines. So what are tetracyclines by the way? Actually, they are derivatives from your streptomyces and your actinobacteria. Actually, these two types of bacteria are also classified as your gram-positive form of your bacteria. Since they are gram-positive form of bacteria, we know that there are difference between gram-negative and gram-positive according to the presence of their peptidoglycan layer. Another thing is that why they are called tetracycline, because in their molecular structure, so when I say tetra, there are four, so they consist of four ring compound in terms of their molecular structure. That is why they are called tetracyclines. And as a nurse, we have to be mindful that some examples of your tetracycline your tetracycline antibiotics, they should not be given example in your milk, because the nature of your tetracycline, they actually bind. Other term for the binding is your chelate. So they bind or they chelate with your calcium, with your magnesium, aluminum, and iron. And as I said, that they cannot be given with along with milk, because as far as we know, milk contains what? Calcium. So that phenomenon, when they bind, actually from the language of your pharmacology, binding or chelate, when they chelate, that is your chelation. So it is not only exclusive to the calcium, but they can also happen to the magnesium, can also happen to the aluminum and your iron. That is why it is highly contraindicated when you are taking tetracycline. Take note, in some iron preparation drugs, and also there are several antacids that contain aluminum. So that is why they should not be given along with your tetracycline, because overall they can cause poor absorption, or yes, it reduces its absorption when they are taken along with this type of products like your calcium preparation, magnesium, aluminum, and iron. Since we have many examples of your tetracycline, actually they end with the name cycline. For example, your tetracycline with the brand name of your sumycin and panmycin, given as PO or your topical. PO and topical form, I mean. Your tetracycline can be given as a prophylactic agent. When I say prophylactic, it is a form of prevention. Prophylaxis for ophthalmia neonatorum, or that is a medical term for your neonatal conjunctivitis. One of the bacteria, actually common organism that can cause neonatal conjunctivitis, are your gonorrhea and your chlamydia. Since it is your tetracycline given as a prophylactic agent for such condition like your neonatal conjunctivitis, it is very important, since you will be handling newborns in relation to your maternal and child health nursing. I would like to emphasize that it is mandated to give tetracycline, since this neonatal conjunctivitis, the one that causes that is also the one that causes what? Sexually transmitted infection. So to prevent that, we need this type of this drug, your tetracycline. We have a brand name sumycin and panmycin. Take note also that it is not only the tetracycline in the form of ointment, but there are also other antibiotics that can also given as an alternative, such as your erythromycin under the broad category of your macrolide antibiotics. Another thing is that when we are giving an ointment to the newborn, we must have to be careful that in giving, the ointment must be from what? From the inner canthus to the outer canthus. From inner to the outer canthus. Next is your doxycycline. Your doxycycline, where the common brand names are Vibracin, we have Eudoxin, Dorix, and Periostat, given as PO. Actually, they can be given with STI. As I said, STI are your sexually transmitted infections such as your gonorrhea caused by Neisseria gonorrhoeae, for example. We have also your it can be a prophylaxis and a treatment for leptospirosis. Leptospirosis that is caused by your leptospira interrogans. That is, there is a word leptos there. Leptospira interrogans is a causative agent for your leptospirosis. Can be spread commonly by rodents. So expect to note that in some community area, when there are high cases of leptospirosis, so they can also be given with doxycycline type of antibiotic to prevent leptospirosis. And also it is given for periodontal diseases. These diseases actually affects the gums or the gingival lining, which in turn causes what? Gingivitis. We have also your minosin with a generic name minocycline given as PO, can also be given as IV. It is actually a drug of choice for treating what? Meningococcal carrier. Okay, meningococcal. And also for uncomplicated GU, or genitourinary infection. We have your UTI, or urinary tract infection, and any gynecological infections. For example, your infection that affects what? That affects the female reproductive organs, such as your fallopian tube. Any infection to that area is considered as gynecological infection. We have also your demeclocycline with a brand name of demeclomycin that can be given as PO or IV. Actually, it is given when the penicillin is highly contraindicated. And since we are talking antibiotics here, so I I hope you understand that antibiotics are intended with what? To kill off certain types of bacterial species. But don't you know that the meclocycline, under your broad category of your tetracycline, can also be given with SIAD? The meaning of SIAD is that it stands for what? It stands for your syndrome of inappropriate antidiuretic hormone. So bakit ba binibigay din ito sa pasyenteng may SIAD? The SIAD is an endocrine form of disorder which can also be further discussed, especially in your medical surgical nursing. As soon as you take other subjects like your medical surgical nursing, some of these endocrine disorders can be further tackled. Your SIAD, actually, for just an information, your SIAD, there's a problem with a certain hormone. We call this hormone as your ADH. That is why there's ADH there, SIAD. Your ADH stands for your antidiuretic hormone. In SIAD, there is abnormal level of your ADH. There is excessive level of your ADH. So, masyadong mataas. Actually, ano ba ang organ ang nagproduce na yung ADH? The answer is that from your posterior pituitary gland, because we have anterior pituitary gland and we have posterior. So specifically, in the part of your posterior pituitary gland, I mean in the pituitary gland is your posterior part that releases the ADH. So what is the function of your ADH in our body? Actually, your ADH, actually, it tells your kidney when to conserve water. So sa madaling salita, kapag masyadong mataas ang iyong level na yung ADH, so from the word ADH, that is your antidiuretic hormone, diuresis. So there is what we call, when we say diuresis, it allows you to urinate also. So pag masyadong mataas, so hino-hold niya yung water, so there is water retention. So there is no more diuresis. So in turn, there is retention of water. So since there is accumulation of water in the body, what will happen also with other organs? Actually, what will happen also with other electrolytes? Actually, it can cause also imbalance to the electrolytes in your body. That is, for example, your your sodium, actually one of the clinical manifestation of your SIAD is that there is decreasing level of the sodium level in the blood because of dilution. There's a dilutional hyponatremia. So masyado mababa yung level ng sodium sa blood, we term as your hyponatremia. Hyponatremia, mababa yung level ng sodium. That is one of the clinical manifestation of your SIAD. Actually, yung function ng why it is given to those patient yung drug na demeclocycline is that it blocks actually the ADH, no? Binablock niya yung pag-release ng ADH. So pag na-block niya yung ADH, since it is an ADH blocker, so anong nangyayari ngayon sa ADH since from mataas, so nagiging mababa. So it gradually becomes into the lowest level or enough onto the normal range of level in our body. So pag ganun, it is highly therapeutic. So, hindi lang siya basta binibigay lang doon sa may mga bacterial infection, but in some other condition, it can highly be therapeutic also. So, again, your demeclocycline is a ADH blocker. So, it acts as an ADH blocker to normalize the level of your ADH. So, again, your SIAD is an endocrine disorder of which the level of ADH is too high, too excessive. That is why, kung mataas yung, again, sinabi ko na pag mataas yung ADH mo, so there is no diuresis, so you cannot urinate, so some of the water or fluids in your body will be retained. So, pag na-retain yun, so magkakaroon yun ng mga alteration din sa mga electrolytes like your sodium that causes what? Hyponatremia. So, bumababa yung level ng sodium sa blood. So, that is your ADH. One of the function of your ADH is to regulate also water balance. So, it tells your kidney when to conserve water. So, ano naman ang mangyayari kung masyado mababa yung ADH? Kung masyado mababa yung ADH, wala namang mag-hold ng water. So, that is why kapag masyado mababa, since there's too low level of your ADH, so anong nangyayari? So the patient will tend to decrease filtering of the kidney, which in turn leads to urination. So nag-urinate siya. So, yun ang nangyayari kapag masyado mababa yung level ng ADH. So that is your SIAD. Pag SIAD, basta tandaan natin, masyadong mataas. So, yung goal natin, dapat pababain natin yung level ng ADH. So, that is your demeclocycline. That is very simple explanation. It blocks the release of your ADH. Then, we have your Oxytetracycline in the brand name of Terramycin. Can be given as PO, IM, or IV. Actually, it is an adjunct therapy. Can be used as an adjunct therapy. Pag sinabi nating adjunct therapy, it is an additional therapy. No? Kaya sinasabi siyang adjunct in the treatment of your acute intestinal amoebiasis. If you notice that your amoebiasis is actually caused by a protozoa, so we know the fact that your protozoa is not a type of bacteria. Since we are talking here's antibiotic, tetracycline, it can kill off what bacterial species. So actually, it is given into the amoebiasis because it is in many forms of your antibiotics, category of antibiotics, it is your tetracycline that it exhibits its effect. Actually, it has an effect to kill off what? To kill off certain protozoa that causes what? Intestinal amoebiasis. Okay, acute intestinal amoebiasis. So, those are your tetracyclines. So, what are the things that we must have to note also when giving tetracycline? Actually, this cannot be given among pregnant women and lactating women. It is because that it has a bad effect to the bones and the teeth. And actually, caution. You must have to precautionary measure in giving this tetracycline because it can cause discoloration of the teeth among children under 8 years old. since I mentioned it can cause, it has a negative effect to the bones and the teeth, and most of the side effect of this antibiotic are most GI, so they can cause nausea, vomiting, diarrhea, and also they can also cause dysphagia and glossitis. So when we say dysphagia, there is what we call difficulty of swallowing, so that is your dysphagia. And also when we say side effects, we must have to take note that the side effects of the tetracycline is highly toxic to the liver. So it is also hepatotoxic, hepa, which means liver. I mentioned earlier that there is what we call glossitis as one of the side effect. When we say glossitis, that is inflammation of the tongue. So that is one of the, we must have to know about these certain side effects of your tetracyclines. So again, those are the points that we must have to remember about your tetracycline drug.